Hi, this is Liza Graves with Style Blueprint, and I have with us today allergist Bruce Wolf, and he is working from home because, like many doctors, they are not taking in-office visits right now. So we're going to talk to him about, some important things. But first and foremost, Dr. Wolf, could you tell us a little bit about your background, and then we're going to get into how can you tell if you've got allergies going on or the coronavirus? And I know that that is a question on people's minds as spring is popping up all over America.
Hey, thanks, Liza. I've been an allergist for about 32 years. I have a Vanderbilt faculty appointment, all that. And I've pretty much been in private practice, and we were seeing patients up until this week. And now we've decided to do things remotely, except for our most severe patients. And, the coronavirus is coinciding with the allergy season, as you know. And typically this would be a time when we would hear a lot of respiratory complaints anyway.
Yeah.
And so one of the big questions has been, how can you distinguish between allergy symptoms and viral symptoms, or in particular, the coronavirus? And I would say that, of course, I don't know if I've seen any COVID patients, because we haven't had the possibility for testing. We've seen people
True.
sound like they might have COVID, but in general, allergy season, when it attacks a person, it causes problems with itchy and watery eyes, with sneezing, with runny nose, and those things are not really seen with COVID.
Okay.
The chief presenting complaints for people that have COVID are supposed to be a dry cough and or fever and or chest discomfort or chest tightness. Then there was an article published yesterday from researchers in Europe that said another presenting sign for COVID, if people suddenly lose their sense of taste and or their sense of smell. So that's being recognized now as, one of the hallmarks or signals that COVID might be present.
So when I hear you say, dry cough and or fever and or chest discomfort and or loss of taste and smell. So from what I had read, and I want to make sure that our readers understand this, that the fever was kind of one of the main things. Hey, if you're having allergy symptoms but you're without a fever, don't worry about this. But if you're having a dry cough without a fever, you should still, isolate yourself.
Absolutely. And allergy classically was called hay fever.
Right. That's true. Yeah.
And so it was possible, or is possible, that somebody could get a very low grade temperature with an allergy, but not the temperature that we're talking about that's been reported with COVID. I mean, think about yourself when you do have a cold and you do have, I don't mean COVID, but you just have the seasonal flu. You know that it's a different, well, you may not know if you don't have allergy, but it's a different sensation of when you're sick. Also what has been associated, and I would say these are, minor symptoms or not as big as the ones I mentioned, but, people have malaise. They don't feel right. They don't feel good. If they reported to have this COVID, they might have aches, et cetera, things that would be consistent with any virus, not just COVID. And that's the other thing that's kind of confusing, is that we're still in the viral season, not COVID, but just the general flu season. We're just emerging from it now. So some people could still develop, I'm going to say, the common cold or, common flu symptoms now. I do want to say one other thing for any listener tuning into this. I am an asthma expert, and this COVID, as you know, puts everybody at risk, but puts people who are older and also people that have chronic disease in a much more threatened demographic, including people that have diabetes and, asthma as an example. So I guess for whoever has asthma, should they start to get symptoms of any type, you should probably call your provider sooner than later so that they're in the loop and they can hear you, what you feel like today. And then if something changes tomorrow, they would be the one to help direct you whether or not there's a next step as far as going to the clinic or, heaven forbid, going to the emergency room.
T- Talk to us just a little bit about these groups that are continuing to get together. When we have a pretty day, we're here in Nashville, you and I both, and it's raining a lot and the sun's going to come out and everyone wants to be outside. How do we get our vitamin D and being outside and still keeping safe, especially?
Yeah, I mean, there's a lot of good points there. You and I have been talking, excuse me, you and I have been talking mostly about the physical aspects of disease and being well, but wellness is much broader than that. And as all of us are sequestered now and we're hunkered down, we need other strategies for us to stay mentally well and socially well if we can. Some of the states started out, you shouldn't be in gatherings more than 50 people. And then it was 10 people. Then it was 5 people. And now one of the states has said, or one of the countries has said, you should limit your engagements to less than 2 people.
Wow.
I think it was Germany that may have declared that statement. I think one thing is that I'm not sure that scientists really know, I'm sure if they did know, they would tell us, but I'm not really sure they know yet how contagious this is. We know it's very contagious, but how does a person determine whether it should be 3 feet, 4 feet, 6 feet from somebody? I mean, it's not like they did a study and said, 100 people stand 6 feet away and see if you get it. So I think that's what, you're saying. You need to get outside. You need to have some exercise. You need to have some movement. This is not just a 2-week thing as they've started out to say it might be. This is going to be a lot longer siege for all of us. And not that I'm wise about it, but for myself and for your listeners, you have to structure some sort of daily regimen so that you do get some exercise and movement and social interaction, whether it's like this, instead of just texting that you can see somebody's face.
Yeah.
I'm an immunologist also. And, from an immunologist perspective, there's some nebulous thing called resistance that we all have. And we don't know all the components that make that up, but a lot of it could be, that you get proper rest, which is not that easy when all of us are going to bed worried about ourselves and our loved ones and the coronavirus, but you need to structure proper rest. You need to get good nutrition now. You need to get exercise. You need to focus on yourself in order that you can try to be as strong as you can if and when this happens. I think one of the fears we all have is that when they finally release the restrictions that we can go outside again, no one knows yet whether it will still be out there. And, by the time we're able to go outside, and if we all have to be exposed to this at some time, hopefully these new medication regimens that they're talking about might be, a treatment that we don't have now, but might be that you take 10 pills and that helps you through it or whatever.
Yeah.
But we have to keep up our strength mentally and physically so that, we can just be as strong as we can to face this.
All right. So as we wrap this up, going back to the beginning, how do you tell if you have allergies or if you have COVID? Sounds like your typical allergies, typical that people deal with. I know some people get a dry cough with allergies. My husband's one of them. Every spring, he just kind of gets this dry cough. But typically, someone with allergies has watery eyes, sinus, sneezing a lot. Typically with COVID, it's dry cough and or fever and or chest discomfort, and now also taste and smell disappearing on you. However, some of these can overlap. And so once that starts to overlap, and it sounds like that is when you need to call your primary care physician. Is that right?
It is. I'd say, again, not to inundate every primary care physician. You start to have problems in your chest, that probably warrants a call to your provider just to weigh in on it. Because if this progresses, if you get COVID and it progresses, that's the chief threat, is it's going to move quickly into or can move quickly into somebody's chest. And, it's nice to have somebody who knows how you were yesterday and how you might have changed today. So,
Yeah, absolutely. Well, hey, we are grateful to all of the physicians out there. We're grateful for you for talking to us today and for everything you're doing for your patients. I know you deal with a population that already has trouble breathing, and so this is especially hard on you and your patients right now. And, we just give you all our prayers and positivity.
all right. Well, you hope all the listeners stay put and stay well, and be well. Okay.
Thank you.
Bye
Thank
bye.
you. Thank you, Dr. Wolf.
Bye bye.
Bye-bye.